Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. November is Pancreatic Cancer Awareness Month, and November 16th is World Pancreatic Cancer Day. About 64,050 people will be diagnosed with pancreatic cancer this year, and more than 50,550 will die from the disease. That's according to the American Cancer Society. So what are the signs and symptoms of pancreatic cancer? How is it treated? And what should you be doing to prevent pancreatic cancer? We'll answer those questions and more with Dr. Brian Boone, a surgical oncologist at the WVU Cancer Institute. Welcome, Dr. Boone, to Tuesday Talks.
Thank you. Thank you for having me.
Okay, so if we're going to talk about pancreatic cancer, I guess we should first talk about what is the pancreas and what does it do?
Sure. So the pancreas is a digestive organ that really has two main functions. One is that it makes insulin, and so it helps keep patients' blood sugar under control and is involved with diabetes. And the other main function is more of the digestive function, which is to help digest fat that's in the diet. And so the pancreas makes enzymes that aid in that digestion and helps break fat down.
Okay. So let's talk then about pancreatic cancer. I mean, this is really a serious and stubborn cancer, isn't it?
Yes, yes. Unfortunately, this is one of the most aggressive cancers that we see. You mentioned the numbers. Almost as many people are going to pass away this year from pancreatic cancer as are diagnosed. And so we've made some progress over the years in terms of the treatments available and the ways we're fighting this, but it's still one of the deadliest cancers. So when we look at all patients with pancreatic cancer, the chances of beating that cancer and being cured are only about 12%.
Wow.
But importantly, that number has doubled over the last several years thanks to research efforts and the part of our team and those around the country. And so there is a lot of reason for optimism.
Good.
As we look towards the future, but certainly a lot of work that needs to be done.
Okay. So what are the signs and symptoms of pancreatic cancer?
So one of the things that makes pancreatic cancer so tough is it doesn't present until it's pretty far advanced. And so a lot of patients aren't going to have much in terms of signs or symptoms. But some of the classic things that we look for is really jaundice, which is where the skin or the eyes start to become yellow. And that's because the bile duct actually travels right through the pancreas. And so it's very common that tumors in the pancreas will block the bile duct and cause that jaundice.
Oh, okay.
And so those tumors tend to not cause any pain. It's just really jaundice, and weight loss is very common as well. And then depending on the location of the tumor, some patients where it's not near the bile duct will just have pain in their epigastric area, which is kind of the upper stomach, up near the chest. And so that could also be a sign of an early pancreatic cancer. So those are definitely things to watch for, and it's especially common to have really profound weight loss. And most of the time, patients might still be eating okay, or they might not have a great appetite, but it's really it's upwards of 30 or 40 pounds in several months of weight loss.
Wow.
that can be an early sign. And then the final thing that is not very specific, but it can sometimes be a clue, is new onset diabetes. So a patient who maybe is not at risk for diabetes, who all of a sudden starts having trouble with their blood sugars, that can be an early sign as well.
Wow, okay. So who's most at risk for developing pancreatic cancer?
So for most patients, they really don't have any risk factors. This is just something that comes up, and there's nothing that could have been done differently or predicted. It's just essentially a random event. But there are a few risk factors that we look for. One of them is chronic pancreatitis. So patients who have inflammation of their pancreas over time can kind of develop cancers. And then there are certain types of cysts that can occur in the pancreas that we can watch over time, and some of them are at risk of developing into pancreatic cancer.
Oh, wow.
And so those cysts can be a risk factor as well. But for the most part, there's not any real strong modifiers. We think that there may be some dietary components, there may be some environmental components, but we haven't really established those well. And then maybe some contribution to smoking and alcohol and things that are common in other cancers also might increase your risk slightly.
So it sounds like, I mean, is there if that's the case, is there anything we can do to prevent pancreatic cancer?
So prevention is tough. I think living a healthy lifestyle may help, in terms of exercise and a balanced diet. But I think the biggest thing is awareness in terms of what to look for, especially for people who maybe are at a little bit higher risk, that kind of keep an eye out for signs or symptoms. Right now, though, we don't really have a great screening test. That's an area that we're continuing to research and look for better strategies. But unlike breast cancer and mammograms or colon cancer and colonoscopies, we really don't have the equivalent for the pancreas.
Wow. So how do you diagnose pancreatic cancer then?
So typically, patients will have jaundice or some of those symptoms, and they'll get a CT scan. And that is where we tend to see the mass in the pancreas. And that gives us our first indication that there could be pancreatic cancer. And then we really rely a lot on our GI colleagues, gastrointestinal colleagues, who will get biopsies with endoscopy. So they'll go down into the stomach with a scope. They can then use an ultrasound to look at the pancreas, and then they're able to do a needle biopsy of the tumor, and that kind of gives us our biopsy proof of pancreatic cancer.
And I know a lot of people may think that if you do get a pancreatic cancer diagnosis, that's a death sentence. But you mentioned earlier, there is hope. I mean, we are improving, aren't we?
Right. We are improving, and historically it has been seen as a death sentence, and the numbers are staggering. And so it's the kind of diagnosis that takes your breath away, understandably. But what I always tell my patients is the numbers are getting better. We have better and better treatments. And the reality is we don't know the future. And so we want to treat every patient like they're going to be one of those cures until we know otherwise. And so that means trying to give every treatment that we can. And each time we get one of those treatments in successfully, whether it's chemotherapy or surgery, we do improve the chances of cure. And so we can kind of move a patient from diagnosis through treatment, and those numbers get better and better. So we have to keep in mind that when we say 12% cure rate, that includes everybody. And that includes patients who have the cancer spread long before we ever discover it. And so most of the patients that I see, it is still localized to the pancreas. It hasn't spread based on the scans, and their numbers are going to be much, much better. And so although it is a difficult diagnosis, we have to stay optimistic on an individual patient level.
So how do you treat an aggressive cancer like pancreatic cancer?
So we use a combination of treatments. Surgery has been the mainstay historically, where we go in and remove the tumor. But for a variety of reasons, we have shifted our approach a little bit more towards using chemotherapy first, followed by surgery, and then more chemotherapy afterwards. And there are a variety of reasons for that, but it really gives us the opportunity to test some different chemotherapy regimens and then remove the tumor and be able to look at it under the microscope and know how well that chemo worked. We also know that it tends to be a systemic disease, and so it spreads early, and chemotherapy is going to go through the whole body and treat that disease. Even if we haven't recognized it on scans before surgery, there could be cells that are in the liver, in the bloodstream. And so if we give chemotherapy first, we may be able to kill those cells and then go ahead and remove the tumor with surgery. So those are some of the reasons that we've started to move towards chemo first.
Then surgery.
But surgery is really the best shot at a cure. And so we want to end up doing an operation where possible that removes the tumor, because we really don't see cure rates with chemotherapy alone or with radiation alone. And so we want to figure out the best combination of chemotherapy and surgery to really improve that cure rate.
So then what are the latest treatments, the newest treatments for pancreatic cancer?
So we're fortunate in the last several years, we've really gotten 2 new chemotherapy regimens that it's a combination of different drugs that have given us better results than we've ever seen. And so we have continued to increase our utilization of those chemos before surgery more and more, and really incorporated that into our standard practice now at this point. And so that gives us better results, whether given before surgery or after surgery. And then we've also continued to kind of refine our surgical approach. So We started robotic pancreas surgery here at WVU about 5 years ago, and over that time with experience, we've been able to kind of expand who's eligible for a robotic procedure and start to use some different techniques in terms of getting the tumors out that allow us to successfully do it with the robotic approach. And so the robotic approach is really, rather than a large open incision, we're able to perform the surgery with small incisions, which helps with recovery. It helps get the patient back onto chemotherapy sooner. And we're showing through some of our research that it might actually be less of a stress response to the surgery with the small incisions, which might have actually cancer benefits down the road.
Okay, well, speaking of research, I mean, you've been working on some clinical trials for the last few years. Can you talk a little bit about those? Are those showing promise?
Sure. Yeah, absolutely. So we're fortunate to have a team here at WVU who really studies pancreatic cancer all the way from the basic science level with cells, pancreatic cancer cells, and with mice to try to understand more about the cancer. And develop new ways to fight it. And so one of the things that has happened over the years is if we've identified some processes that occur in the immune system that we can target. And so by generating these treatments in the laboratory, we're now able to translate them to patients. And so we have a clinical trial at WVU that is basically targeting specific cells in the immune system that we have shown to be detrimental to promoting the cancer. And this is really the only trial of its kind in the country where we're able to give a pill that's it's taken by mouth, and it's really easy to take, and it's safe and well tolerated. And we've shown that it makes the chemotherapy more effective.
Wow.
It prevents blood clots around the time of surgery, and it also inhibits this or blocks this immune response that we're seeing based on the work in the lab. So we're really excited about that trial. It's continuing to be ongoing at this time, and it's a new treatment available to patients right here at WVU. The other thing I really like about the trial is they get the standard chemotherapy anyways. And so we're not withholding any treatments that they would otherwise get, but we're just seeking to add to that and make it even better. And so it's a very incremental approach to try to take that 12% survival number and make it much higher. And so patients really like the fact that they can get the same chemo either way. We just add an extra drug to it. And so that's been a very exciting trial to have running, and we've seen encouraging preliminary results, but we're still waiting on more data to really make conclusions. So far, it's been shown to be very safe and looks like it's effective as well.
Great.
And so we look forward to continuing to accrue to that trial and really get a definitive answer in the coming years.
So what if there are patients out there that are interested in, how do you sign up for a clinical trial or apply for?
Sure. So there's a lot that goes into seeing if patients are eligible, and so that usually starts with meeting one of us in the office, either the surgical oncologist or the medical oncologist, and understanding the staging of the cancer and the type of the cancer, and seeing if there's eligibility. And then we have a team that works with our clinicians that's just dedicated to clinical trials, who will come and talk to the patient and go through the protocol and review the consent form and really make sure that they're eligible. And so it really starts with a clinic visit, and we evaluate all of our patients, not just for that trial, but for any trials that are available around the country, as we have several that are either sponsored by companies who are doing trials of new strategies. Those are available to our patients. And then also national trials that are available throughout the country by different cooperative groups that kind of sponsor some larger scale studies.
So there's a lot of possibilities out there. World Pancreatic Cancer Day is coming up very soon. So can you talk a little bit about what the WVU Cancer Institute is doing to help mark this day?
Yes, absolutely. So we're very excited. This year we're kind of expanding some of what we're doing to engage the community. Our team really feels that community engagement is so important to raise awareness for this cancer. And we also like to raise money for research and things like that. And so, so many of our team and our patients have had their lives touched by people who suffer from this cancer. And so it's important to be able to give back. This year we have several different events going on, one of which is actually a bowling event where our team gets together and we have fun with a bowling fundraiser that helps to raise funds for pancreatic cancer and pancreatitis research. So that kind of kicks off our Pancreatic Awareness Week. And then this year we have a visiting professor who's an expert in pancreatic cancer who will be presenting his research, visiting us this year. And then that's followed actually by a pancreatic cancer survivor lunch. So we want to bring our patients who have suffered from this cancer and are beating it to come with their families and join our team and really celebrate the success that they've had and recognize all of their efforts. And it's a great way to build camaraderie with our team as well, and also just acknowledge the impact that our patients have had on our team and really celebrate their survival.
Do you have to be a good bowler?
You do not have to be a good bowler at all, and we're just excited. It's just such a fun event. But yeah, and you don't even have to bowl. So there are opportunities to come. And one of the other things we like to do is not only raise money, that event is through the National Pancreas Foundation, so that benefits research around the country, but we also are trying to grow our efforts to support the pancreatic cancer research program here as well. And so we have a fund set up for patients or families who are interested in trying to expand the research that's being done here at WVU. There's an opportunity there as well.
Can you talk a little bit about the expert team at the WVU Cancer Institute and how they're leading the fight on pancreatic cancer?
Sure. We are incredibly blessed to have a great team. I'm just one member as a surgical oncologist. We regularly work with our medical oncologist, radiation oncologist, GI team, pathology, radiology, pharmacy, nutrition, and we have people in each one of those positions that is dedicated just to pancreatic cancer. So one of the things that's unique to us and many of the other major institutions around the country is we have a dedicated team that focuses only on this. And when you're talking about a cancer as aggressive as pancreatic cancer, that's really important. This is something that we see on a weekly basis and we take care of frequently, and that kind of expertise really helps to maximize outcomes. We've also tried to make our approach very patient-centric, and so we have a pancreatic cancer clinic where they can see multiple providers at the same time. We have our pancreatic cancer tumor board where we just focus on patients with pancreatic cancer and review them as an entire team. And so seeing our team here means you get everybody's opinion and expertise, and that really leads to the best outcomes.
So there's hope.
Absolutely. Like I said at the beginning, there's lots of reasons for optimism. We have made improvements over the years, and we're going to continue to make improvements. And we really want anybody in West Virginia to have confidence that the team here is as good or better than any team around the country. And I think our results have shown that. Excellent.
So before we go, what's the most important thing you want our viewers to know about pancreatic cancer?
So I think we acknowledge it's a difficult cancer, but we are in the fight to make things better for patients with pancreatic cancer and improve that survival rate. We really want to partner with the community to accomplish that goal, and I have a ton of confidence in our team to be able to give really the best outcomes for patients who suffer from this cancer, and we're right there with you in the fight.
All right. Well, thank you so much for sharing this information and sharing that there's hope. There's always hope.
Thank you for having me.
Well, it's great having you here. Thank you. That brings us to the end of this edition of Tuesday Talks. If you're looking for more information about pancreatic cancer and other cancers, visit wvumedicine.org/cancer. I'm Mary Ravazio Menard, and on behalf of Dr. Boone and everyone at WVU Medicine, thanks for joining us.